Okay, Michael, could you just brief your story of weight loss and diabetes control, and how did you get to us here in this hospital?
Yeah, I just get add-on years in the TV.
Okay.
Yes, I was type 2 diabetic.
Okay.
So
You were
my
on
sugar-
insulin? In the
Insulin. Yeah,
injection?
my sugar is very high at that time.
Okay. How much was it? Do you remember?
It goes to like 300.
300. Okay.
300.
So
A
after
lot.
surgery, what about insulin? Did you need any more insulin after surgery?
No.
It was not required?
No.
So
any
it has been
insulin.
like 8 years plus.
No any blood pressure pill either.
Okay. No blood
I
pressure
used to
pill?
take Avendia
Uh-huh.
and cholesterol pills.
Okay.
Everything is normal right now.
And your blood sugar has been normal throughout in these 8 years without
These days,
insulin?
yeah, without insulin.
That's good. And what about your weight? Did it stop at I can see that you lost about 35
30
kilos.
something, 35,
Yeah.
40 kilos.
So is it stable or is
It's
it going
stable.
up?
For this many years, it's so stable.
For 8 years,
Yeah.
I mean, it must have took like 1 year to come down.
Come down.
And after that, it has been almost the same.
Same.
Because we are meeting probably like now after 6 years.
Yeah, 6 years.
You came back in 2016, though your
16,
surgery was done in 2014.
2014, yeah.
Yeah. So you are in US? Which
USA,
part
yeah.
of US?
New York.
New York, okay. See, now it has been 8 years.
8
but
years.
you being young, we are talking about like what's going to happen 10 years further down the line, maybe 20 years, what's going to happen. If you gain weight, your diabetes can come back.
I know it.
Okay, yeah. We must understand that we have not eradicated the diabetes. It's just a good control. And how you got the control, it's because you got a new sensor. Now your food is going like 6 feet down the line and it's touching a new point, and the sensor is strong. Every time you take some carbs or sugars, now it keeps a good control of it. But it might get tired, it might get desensitized again after 10 years, 20 years, you never know. We see this happening in about 5 to 6% of the patients.
But
So
this
be
many
careful.
years, my weight is controlled.
The good thing is that your weight has been stable.
It's stable.
Yeah, there are patients who would be taking like lot of soda pops, cold drinks, or alcohol. Do you take some alcohol?
No, I don't take alcohol.
Okay. And what about other habits, sugars?
I try to get sometime like a piece of chocolate small.
Okay,
But there's a kind of
like a normal human being,
yeah.
not like addiction.
No, like
Okay, that's good. So if you behave like a normal human being,
But this
and-
all depend on food, which
Yeah.
kind chocolate you eat.
yeah,
Chocolate you eat like
if you are
full of
crazy,
sugar, and if you can
then you
chocolate,
can fail
eat
any
with
surgery.
like,
See, for surgery there is a limit always.
Limits, yeah.
So I can do the surgery according to guidelines. We cannot do too much. If we do too much, then you lose too much. Then there are all kinds of deficiencies coming up. The good thing has been that there is no problem.
No, I know
You
I
have been doing good. Sugar, blood pressure, everything is good.
Yes, very good.
But down the line, maybe after another 10 years, 20 years, we wish that you would be the same. If you keep on doing the same things, same habits, continue, you'll be the same. But you can even be better if you want to lose like another 10 kilos. So keep a check on your carbs and increase your fiber intake. Like take more of salads, veggies, take more of fruits, salads, and less of rotis, carbs, breads.
Nice.
Don't keep on eating like sometimes somebody got the habit of taking tea or coffee. You take 1 or 2 pieces of bread or biscuits. That's not a good habit. At night, give rest, give complete rest to your liver. That will help you in a big way.